Hello, good evening, ladies and gentlemen. Can you hear me clearly? If you can you just say yes, you can hear me at the comments? Hello, good evening, everyone. All right, thank you. Right, so we shall start. Good evening, ladies and gentlemen. Thank you for watching us again. So you're in NSCMH Facebook Live. I'm Miss Xiao, the pharmacist from NSCMH Medical Center. So today we have Mr. Victor Lim. He's a pharmacist and he is the owner of the page called The Pharmacist Way. Our topic is, can our parents stop taking their medication? So as you may have familiar, once your parents need to take certain long-term medications, so for example, if they are recently diagnosed with high blood pressure, so they will be very concerned. So first thing is about side effects. The second thing is the cause. And the third thing is, do I need to be on this for long term? That's the scariest part, isn't it? Like, imagine you have to start taking something forever. So today, Victor, he's going to answer all this for all of you. And before I start, today is a very important day. It's a Happy Mother's Day. I would like to say Happy Mother's Day to all Mama. 母亲节快乐. If you're stuck in somewhere and you're not home, remember to give them a call and say you love them and Happy Mother's Day. In conjunction with Happy Mother's Day as well, today, we are going to give out 3 secret prizes. 3 secret prizes to our lucky audience. So what you need to do is, please like and share this Facebook Live. Again, I said, please like and share the Facebook Live with a hashtag, I love my mom because. Can you hear clearly? I repeat again. So there's 2 criteria. 1, you have to like and share this Facebook Live presentation. And second, you have to hashtag and say, I love my mom because. So Victor and I, we are going to choose the 3 most creative answer. So actually 3 prizes, but actually 1 from him and 1 from NSCMH. So stay tuned. So after the presentations, we are going to tell you what are the prizes. So without any further ado, I'll just quickly brief you guys. Our presentations will be about 45 minutes, 30 minutes of presentations from Victor. And after that, we are going to have Q&A session. So if you have a lot of burning questions about the long-term medication for your parents, please stay tuned. And during the session, we are going to repeat again how to get the 3 secret prizes. All right, without any further ado, I shall invite our speaker today, Mr. Victor Lim.
Hi, hi.
Wow,
Hi, everyone.
Nice
hi.
Where did you get your haircut?
Get it from my relatives.
Get it from a relative. Okay,
too long already. Too hot and too long. Cannot tahan. Have to go and cut.
Okay, okay.
The home type lah.
Okay, so I shall let you have the session now.
Yeah. So what is like what Sel say? First of all, I would like to wish all mothers Happy Mother's Day. And please do share the page, the live section, and hashtag I love my mom because we will choose the best. I mean the best comment on it, the best reason why you love
the
your
most
mom.
creative one.
The most creative one.
Yeah.
And we'll choose during the live session. Please do share it out. The live sector, the prize will still be secret, right? Yeah,
still be secret.
Still be secret lah. So
yeah, after your presentation, approximately 20 minutes, then we are going to tell what are they. But yeah, you can start thinking what is your best answer first. Just like, share, and then hashtag.
Yeah, you can try to share it up first before we start it out, because right now it's about 32, I think 30 plus people looking at the live session. So hashtag I love my mom because and then share it out the live session. Okay, then we will continue with the slide first lah. Okay, can we start?
Yep.
Okay. So as I said, this is a special live session. It was requested by lots of NSCMH customer and patient who would like to listen to the same slide. Actually, it's in Chinese. Previously it was started in Chinese, and now we translate it into English because there's a lot of patient who did not understand the slide. We would like to present this. Hello. I would like to present this to let everyone understand the condition of can my parents stop their medication? Okay.
Hi Victor, you're all right? You can do the sharing, right? From your side?
Yeah. I think can.
Okay.
Okay. So please hashtag I love my mom because, and we'll start with the slide first. Okay, first of all, I would like to thank NSCMH for giving me this chance to present it to everyone here. And I would like to introduce myself. I'm the Pharmacist Way. I'm the page owner of the Pharmacist Way. It is actually a page to answer all queries for all the audience. Hello. Hello, Xiao.
Yes.
Yeah, I think the slide is not on the screen.
Oh, one moment now.
The slide is not on the screen.
Can you try again?
Okay, I'll try again.
Yeah.
Can anyone see the slide? I think the slide is not on the screen, yeah.
Okay. Can you try it?
Yeah, I'm actually watching the live. The screen, the
That's
slide is
fine.
not on the screen. Yeah.
You try again because I think there's some technical. I just removed it. Can you try again?
Okay. Okay, sure. I'll try again. Okay.
All right.
Okay. Sorry for the technical error. Okay. So this, I would like to wish everyone a happy Mother's Day, and it's actually requested by most of the people that watch our first Facebook Live. Okay, and to wish to understand in English for the first time. So please hashtag and share it out for the Facebook Live because we have special gift provided, sponsored by NSMH and myself for you and for your parents, for your kids. Okay, first I would like to introduce myself. I'm actually the Pharmacist Way, page owner of the Pharmacist Way, a page that try to answer all types of medication question, and I'm the page owner of it. I'm Mr. Lim, and good evening to you all. Okay, folks, for this topic, we're going to talk about can your parents stop their medication, especially the long-term diseases. Okay, and I'll try to use my experience to explain it instead of using any medical terms, jargon to make things difficult lah. I'll try to share it as easy, as simple as possible. Okay. First of all, I would like to tell people, let everyone to understand what is long-term diseases first. Okay, I think most of you know what is long-term diseases. Okay, long-term diseases includes, high blood pressure, diabetes, and cholesterol. Okay, so for high blood pressure, I will explain it in a simple way. For high blood pressure to happen, first, your blood vessel will start to become very hard, become so hard that it will exert pressure and it will burst anytime soon. Second will be your issue in your heart. When there's some issue in the heart, the pumping will be faster, the pressure will be higher. Third will be your kidney. When your kidney regulation is not that good, like the salt and all that is tend to give higher, you will have a blood pressure issue as well. And all this is caused by lifestyle stress, the long-term lifestyle stress like smoking, working stress, and diet and all that. Okay. So what will happen if you don't take care of it? You don't take care of your pressure at all. If it happens in your brain, it will become stroke. If it happens in your heart, it will become a heart attack. If you don't care at all the time, pressure was maintaining at a higher level, it will spoil, it will hurt your kidney. You'll get kidney failure soon. Okay, so please do take care of it. Do take note of that. Okay, if your parents have blood pressure, do take note of that. Okay, second will be diabetes. So in diabetes, I'm going to explain in a simple manner. First, all diabetes divided into two types. There will be type 1 and type 2, and it all going to affect your pancreas. Okay, so in type 1, I'll call it as a simple term of you born with it. Okay, you born with it. If it's type 2, you make it yourself. So what does it mean is you born with it, it's like a genetic issue. You born with that problems that cause your pancreas couldn't produce enough insulin when time comes. Usually around 20 years old plus, 25, 20 years old, around that time. For type 2 is you make it yourself. You didn't take care of your diet, your lifestyle stress and all that, your high intake of sugar, you're going to hurt your pancreas for the long run. And there is a study that found that 70.5% of Malaysia are having diabetes. Means out of 10 people, 1.5 is diabetes. So please take note, our Malaysian is having a very high rate of getting diabetes right now. Okay. Second will be cholesterol. Most of the cholesterol uncle and aunties will only know the total cholesterol level. Okay, the total cholesterol level. But actually, cholesterol have been divided into three main categories that everyone have to read it. Okay, first is good, the bad, and the triglyceride. Okay, in the good, in a simple way of explaining good is actually a small cholesterol that floats around your blood vessel to collect the cholesterol. So once it collects until it is full, it will become a bigger cholesterol size. Okay, and that is when it turns bad. Okay, so when TG, what is TG? TG is actually the fats that we consume in the meat, the calories and all that will convert into fats, and that is what we call it as TG level, triglyceride level. Okay, so what is it important to all three of this is because most of it they need different treatment plan. So not just only total cholesterol, you have to know which level of it is high. So most of the uncle auntie I experience is they are not sure. They just know that they have a high total cholesterol level, but they don't know which one is high, the good or the bad or the TG level. Okay, explain even furthermore, is all cholesterol have to be digested in your liver. Okay, and digested produced by the liver. The other way is from your food, consume from your, the fatty foods, the burgers, the meats and all that. So when cholesterol happens is when you don't take care of your diet, your metabolism of your liver is getting lower. That is when you get a higher cholesterol level. When you don't take good care of it, most of it doesn't have any signs and symptoms. So they are going to have a high cholesterol level without noticing. For long-term wise, it will become a blockage issue. Once it becomes a blockage, if it's in the heart, it will cause heart attack. If it's in the brain, it will cause stroke. So please take good care of your parents. Let them know their condition. Okay, so back to our topic. Our topic is going to talk about, can they stop taking their medication? Okay, can they stop taking their medication? Most of the time, they were gonna ask us, as a medical professional, three questions most of the time when those uncle and aunties or elderly people having long-term diseases. These are the three most common questions. Will medication cure my problem? Will it hurt my organ? Mostly they're gonna say my 瓜饼干, my kidney, 我的腰子. And third is, can I stop my medication? Or either they stop themselves. Okay, most of the time it's these three questions. Okay, and I'm gonna try to answer it as simple as possible. First, can medication cure my problem? This is a very common question that we pharmacy have been asked all the time. Okay, so I'm going to explain what is medication, what is a medicine. Okay, we have to understand what is a medicine. A medicine is actually a chemical product. In a simple way, we have to know it's a chemical product that have been go through a lot of studies to prove its function, its side effects, and its safety profile in order to sell into the market. Okay, once everything has been established in a simple way, they can produce a medication. And there are millions of medication out there with different function. Okay, if you have a pain, we're gonna give you a painkiller. If you have a high sugar level, we're gonna give you a medication that can lower your sugar level. Okay, so to be honest, most of the medication for long-term diseases, it doesn't cure, but it controls your condition. It is very important for this controlling part. Okay, what do I mean by that? Okay, imagine your body is like a car moving up a steep, a steep hill. Okay, moving up a steep hill. So our body is like a car. After a few years, we tend to break down. Our engine tend to break down. There's some issue with the car. And once it's break down, because we are in a steep hill, we're going to fall back. We are going to fall back, which is very dangerous. Okay, but in the car, there is a function called brake, which you can stop the car. Okay, and that brake is actually the medication, the reason of taking a medicine. Okay, so in a real scenario, if you have a high blood pressure, very high blood pressure, this blood pressure going to hurt, going to get your risk up to get a stroke, a stroke, a heart attack, or maybe an organ damage, risk higher. So medication is here to stop this problem, to control this problem. Okay, and at the same time, I'm also answering the second question. Will medication hurt your organ, your kidney? Okay, it is actually won't hurt your kidney that much if you don't control your diseases. Long-term diseases without control are the one who gonna hurt your organs, not the medication. And medication is trying to help your condition. I'm going to give a few examples later. Okay, so will be the third question, most common asked question, can I stop my long-term medicine? Bad news is most of the long-term medication couldn't be stopped, but we can adjust your treatment. Later on, I will give a few examples. Okay, what do I mean by adjusting your treatment? Okay, adjust your medicine. So before that, I have to tell you what should we do first. What should we do? Okay, there are three things that there are the two main things that you as a patient or as a parent or as a kid to let your parents know. Two things they have to know. First is to understand their medicine, their medication, their treatment. Second will be understand their condition. Let's say they have high blood pressure, they have to understand what kind of issue they have. What do they need to do? Okay, then only we can ask to change as in reducing the treatment or to change a healthier lifestyle without medication. There is possibility. Later on, there are a few cases that we can share it out. Okay, so understand your medication. They are two important. What do I mean by that? Okay, first thing, this is a question for everyone. Okay, for patient A, he's taking 3 boxes of pills back home. Okay, for patient B, he is going to take 1 box of medication back home. Okay. So which is heavier? Which patient is heavier? Okay. So one is taking 3, another one is just taking 1 box of medication back. And most of the time, people will choose A because there are more pills to take. But actually, for blood pressure control, B will be higher. The patient B is taking a stronger medication to control his pressure. Okay, what do I mean by that? So this is the part that we have to understand. We have to let the patient understand their medication. Okay, first, this medication consists, simple terms that consists of ingredient called valsartan, a medicine called valsartan. And this valsartan not just controlling pressure, okay, it also help to protect liver, to protect your kidney, okay, your buah pinggan. Not like everyone else say it hurts your, take medication will hurt your kidney, long-term wise will spoil your kidney and all that. It actually helps to protect your kidney. Maybe once the doctor get your profile, he will give the medication because you have some kidney issue. They will give this blood pressure medication to reduce it down and also give a protective effect on your kidney. And third thing, it also reduces down the heart issue, the heart failure death. So this medication understanding is very important because once we explain like that, I believe most of the patient will really accept their treatment. Okay, not just blood pressure, not just like what everyone else say, you take it every time, it's gonna hurt, gonna spoil your kidney. No, it won't. It actually protects your kidney. Okay, so the second thing what I would like to explain is understand your condition. Most of the elderly, they actually kind of reject to go and see a doctor or see a pharmacy or accept their condition. So most of the time, I divided them into two categories. One is does not visit the doctor at all or become a doctor themselves. Okay. One is they don't visit them at all. They'll just buy a medication themselves. Another one is they become a doctor themselves. They're going to buy anything to try it out or maybe stop their medication or whatsoever. They will try to just avoiding taking medication, which is very bad. Okay. So an example, what do I mean by that? Let's say elderly people, okay, firstly diagnosed with high blood pressure, okay, and for the first time once they diagnose high blood pressure, most of the time doctor will give a blood pressure controller for them, okay, to try out whether and ask them to go and see the doctor again, to visit back the doctor again, okay. But most of the time the uncles and auntie will just buy medication monthly for themselves and just take it like that. They will not visit back the doctor. They will just buy the medication and just take it like that. Okay, no checkup at all. Take it daily. That's all. Okay, but what this problem will cause is they do not check up with the doctor. We will not know that whether this medication will work for them or not. Most of the time, customer came to my place, if they take medication, I'm going to do a blood pressure check for them to at least let them know their condition, because without checkup we will not know whether the medication is effective or not to control the pressure or whether the blood pressure is under control. Okay, once they do not do checkup, when pressure goes haywire or goes bad, we may need more medication to control his condition. So this is why there are a lot of people taking multiple blood pressure medication for just one condition. This is because some of them, they do not go and check up. They do not care their pressure at all. Okay. So it is very important for those two things, because those two things must be done. and medical team going to assist you. We medical teams, a doctor, a pharmacist, a nutritionist, or anything, they're going to help you to let you understand all your condition. But please let them check up all the time. Okay, for long-term diseases, I will usually recommend for 6 month checking every 6 months or every once a year to let them know their condition and let the pharmacist to explain to you your medication, your condition. Then only we can ask you to change your lifestyle, to reduce, to adjust it down. Okay, what do I mean by that? I can give two actual cases. Later on, I'll give two actual cases that there's a slight changes of their medication. One is good and one is going to be bad. Changes of additional medication, another one is changes of reducing medicine. Like what I say, is going to stop their medication. Okay, actual case one. This is the bad one. Okay, a patient came in that, buy a medication, mostly take a medication for their blood pressure, but she take it for 10 plus years. She never stopped the medication at all. She take it for 10 plus years. Okay, never do a medical checkup, but she check herself. Okay, she would just go to a pharmacist and do a blood pressure checking all the time. But what we found that after 10 years of taking the same medication, although the blood pressure is good, but the heartbeat tends to get faster and faster. Okay, time after 10 years taking the same medication, the heartbeat tends to get faster, although the pressure was good. Okay, so this comes because this customer came to my setting, I tend to do a report for her. We asked her to go and see a doctor because the heartbeat was fast, which is not good, which is a sign for heart related issue. We asked her to go and do a medical checkup from a medical team by a doctor or anything. And what they found is she really has a heart issue. She has a heart blockage issue due to the fact that she's been taking this telmisartan, this medication for 10 plus years without checking. Her heart issue tends to get worse and worse because of some other related issue, which is a heart blockage in the heart that cause fast pumping of the heart. Okay, so at that time we have no choice to add another medication to control his heart. But if let's say she continued to take this medication for another 10 plus years, they may have a risk of getting a heart attack. So at least right now she know her issue. That is why I ask most of the parents and adults to go and do a checkup most of the time. Because if they don't do a checkup, they will not know their condition. Okay. So second case, this is actually a good case that I would like to share to everyone. It's a very special case, to be honest. Okay, same thing, same medication, telmisartan 80 mg, a blood pressure controller. Okay, taking it for 10 plus years. Okay, not changing it at all. Okay, check himself most of the time, to buy a blood pressure machine, check by himself. But the only changes in his life is he retired. He retired from his work. He's starting to enjoy his life and have more time to exercise. But what he experienced next was after a short period of time of retirement and enjoy life, after he take his medication, he will felt dizzy. Okay, he will felt dizzy all the time right now. So the same case, we're going to check his pressure. We're going to write a report. We're going to ask him to go and visit a doctor. Okay. With the medical checkup and all that, they found that because of the lifestyle changes, the medication is too strong for his condition. Okay. Means that because of this lifestyle, the enjoyment of life, the exercise, the healthier lifestyle, the pressure tend to become healthier. Okay, to become, lower it down. and this medication 80 mg is too strong for his condition. So the medical team, the doctor, have to reduce it down to 40 for his condition, because this medication you cannot take it away straight. You have to reduce it down professionally. Okay, so adjustment can be made. Adjustment really can be made, but it needs a lot of effort to put in it, like lifestyle changes, like you know that smoking is causing a lot of issue for your blood pressure. You have to change that. Okay, this is a take-home message for everyone. I hope that uh, um, everyone understand the condition. Medication can be stopped or can be reduced it down, but in the criteria of knowing your medication, knowing your condition, and make changes. Okay, I hope that everyone can take home these two message. And happy Mother's Day to all. During this session, we're going to give out free gifts to the for our viewers, and thank you for all that. Any questions for this session?
Okay. Right. Okay, thank you, Victor, for the presentations.
Yeah.
Right. So I guess that's very common. So which means, can I just summarize that there's
Yeah,
no
can.
there's no what you call, we can't really stop taking unless
Adjustment can be made.
adjustment can be done.
Can be
Which
done, can be made. There are a lot of cases that blood pressure medication taken away straight. They are, but
okay.
most of the time is people will not change their lifestyle. They know that this is the bad habit that caused their blood pressure, but most of the time they do not change that. Yeah.
Yeah, I mean, like,
Mm.
I guess that's a misconception. Maybe taking medication, they thought it's like a magic pill. Your condition,
Yeah, they thought it's
get
like
back
a
to
magic.
normal.
Yeah, they they thought medication is to cure, but most of it is not. It's for controlling.
It's for
And I
controlling.
hope the message will pass it out lah.
I think I really like your analogy when you describe it's like a car. So
But it's
yeah, if you're 20 years old, surely there's some parts that needs adjustment. However,
yeah
become a new car again, no. So taking the medication is like the putting a brake.
putting a brake
Putting a
when
brake.
you are falling back. Putting a
Yeah.
brake when you're falling back, but it will not move forward.
Mm-hmm.
That's the point. The medication is like a brake. Once you step on the brake, it will not move forward. So the only way to move forward, you have to fix your engine, but the brake is not to fix your engine. The way to fix your engine is another way.
Therefore, it's very important to take your medication, because if you don't press the brake, you know what?
Yeah.
We will go down to So I guess I really like the analogy. So I'll quickly go to the comments. So we have a Miss Sang here. Patients on prazosin, will it cause ED? Yeah, some people are on it for quite some. Sorry.
It does cause ED. There are certain possibility or percentage, if I'm not wrong.
Yeah,
If
I
I'm
mean,
not wrong.
ED means what do you mean? Yeah, erectile dysfunction.
Erectile dysfunction. For our viewers, it's called Chinese called 不能啊，不能啊，不行啊，不行，不行 cannot. Okay, erectile dysfunction. But there is because I read the report long time ago, couldn't remember. It says that it the vessel there tend to dilate too much. Blood flow tends to, I don't know, I forgot already. I have to read back.
Okay, but it does affect, yeah. I mean,
It does
what
affect.
advice would you give to such patient?
For prazosin?
Yeah, it's already on prazosin, so we have to change the medication. I mean, we want
Mm,
it, but
there is medication for ED,
mm-hmm.
but it has
Ah,
to be done by professional, given by doctors to check your
okay.
condition, your pressure, if it's, stable, and
Mm-hmm.
prazosin is causing your ED. But
Mm-hmm.
there is some status that people will take ED medication because ED is
Mm.
not for daily use, it's for when
When
necessary.
necessary.
Yeah,
Okay.
when necessary. So
Uh-huh.
maybe this is
Okay.
a very good topic to tell, to
Okay.
talk about.
Yeah, maybe the next round.
Yeah.
So I've got
Mm.
Mr. Kamarudin. Any chance that I can stop statins if my cholesterol is already controlled?
Ah, this is a very good question.
Mm.
Uh, from right now, I from government setting, they don't stop statins unless your cholesterol level are too low or something.
Okay.
I did ask during my attachment in the government setting before,
How do
but
you define low? I mean, like too low, sorry.
too low is when your bad cholesterol, because even though bad cholesterol have to be low, but there are
Mm-hmm.
some certain lower limit to reach. You
Okay.
cannot be too low, you cannot
All
be
right.
too low. You have to
Mm-hmm.
reach on the the midpoint of it, 2 point something,
Mm-hmm.
I forgot. Okay, so right now, in all the private setting, mostly the
Mm.
clinics and all that, they will tend to ask the patient to stop after 3 months. Means they take it for 3 months. They'll do
Okay.
a blood test again. If the
Mm-hmm.
blood test is good, they will try
Mm-hmm.
to ask them to stop and ask to
Okay.
give a good advice of lifestyle changes, of diet changes and all that. If
Okay.
let's say the lifestyle
Mm-hmm.
changes and diet changes with 1 or 2 months,
Mm-hmm.
your cholesterol level still maintaining the same, then they will not starting again. But if let's say after 1 or 2 months, your cholesterol level tend to get higher, just one or
Mm-hmm.
2 months, okay, of stopping starting, they will
Mm-hmm.
start back the starting again.
Okay.
Yeah,
So,
I see
mm,
there's a trend of going this way. Last time there isn't. Last time is you have to take it every time. Okay, even though
mm,
you're having
yeah.
pain, they're gonna change it to a lower one. They change it to a
Mm-hmm.
lower one, you're still having pain, they ask you to cut it to half or something.
Mm-hmm.
Or they will change it into another type
Mm.
of start of
Okay.
cholesterol lowering agent. Yeah.
Right. So if I just a quick summary, so I say it very depends on the doctor judgment, but what we observe is in the government they don't usually ask you to stop it unless your cholesterol is way too low. In private setting, what we observe is doctor usually prescribe for 3 months. However, with diet and modifications, if your blood cholesterol improve, they may ask you to stop for 1 or 2 months to monitor further.
Yeah,
So if
something
it
like that.
improve, then we don't have to continue to be on the cholesterol medication. However, that's still on the doctor judgment lah.
Still
Okay.
on the doctor judgment.
Okay. So I've got the Shakina asking, how about if patients have allergic to hypertension statins medication? Should they stop or continue?
Hypertension starting
Yeah,
medication
if they're allergic.
means they're allergic to hypertension medication or statin medication.
Yeah, maybe I'm
Both.
guessing it could be as a general if they have allergic reaction.
Allergic reaction. Okay.
How would you define like allergic reaction?
Oh, it is
Stop
very,
taking
very
it.
broad. It is very, very broad.
Mm,
Very broad.
yeah.
Okay.
Mm,
Uh, maybe I can share this out. This
mm,
kind of a very good experience I faced that I need to fill a form during my attachment.
mm-hmm.
Okay. It is not allergic reaction, but people tends to think that they are allergic to it.
Okay.
Got one customer or one patient came into the setting, says
Mm-hmm.
that he is allergic to amlodipine, which is a very common medication to give for high blood pressure for the first time. Okay, amlodipine. So when we ask, we have to fill the form. And we ask what kind of allergic reaction, it says, headache. It says once I take it, I'm having headache, which is not an allergic reaction, it's actually the side effect, of it.
Okay.
Okay, allergy reaction usually is, itchy or that. But what we tend to do once we found that he is not suitable to take that medication, whether it's a side effect or allergy, we'll try to change it to another class of high blood pressure. We'll write a card, we'll say that, this patient is not suitable to take this because allergy reaction or just side effects.
Okay.
Then we will.
Yeah. So I hope that answers Shakina. So very important. You need to get it very clear what's side effects and what's allergic. So sometimes we might get confused. Then if you stop the medication abruptly, then it will not do any. Okay, but obviously if it's very serious allergic reaction, like edema, swollen of the lips, I cannot. Yeah, then you have to stop immediately.
Yeah, and one more thing is if it's a side effect, some of the cases they will try to change another brand. The same medication but another brand, because you might just allergic to the ingredients, itself, not the medication. So they try to change it to another brand to see whether it's just the brand issue that caused the allergic reaction.
Cause allergic, okay. It may be due to the brand as well. So like this,
Yeah. If
you're
it's
all right
for
taking this brand and some other brand.
Yeah.
So we
They'll
have
try to do that.
yeah, we have Marcus here. Is there any way or method that can help us to reduce our number of medications, to reduce medication and become more healthy?
Yep, there is. Like the case 2.
Mm.
Case 2 scenario is really very special because I can say is a customer or patient who came here to buy that medication, who get that medication all the time. Okay, he gets the medication all the time just because retirement. Okay, just because of his retirement, he tend to have more time to enjoy his life, to exercise, and because of that lifestyle changes, his pressure tend to get much more control.
I see.
Yeah. And
Okay.
then to get much more control, we have no choice. They have no choice to reduce it down to 40 mg, from 80 to 40. Yeah, because the 80 is causing dizziness, the 40 will not cause dizziness because lower blood pressure. Yeah.
Okay.
So
I
there
hope
is.
that, I hope that answer Marcus. So Marcus, we must try to find a way how to retire early so that
Yeah.
you'll be healthier,
The
right?
workload, the stress, the MCMO extension gives a lot of stress to
Yeah, a
everyone
lot
right
of
now.
stress.
I
Yeah.
hope
So
everyone does fine right now.
okay.
Yeah.
So we have Miss Yip. Will arginine supplement helps to reduce blood pressure?
Oh,
Mm.
this one, arginine. Arginine is a amino
Dilate,
acid, if
right?
I'm not right. Amino acid something for
Mm-hmm.
bodybuilder, for a few function, but blood pressure I don't think I know. I don't think I know. Sorry that I couldn't answer that question. But what I can say, there is a supplement that has been developed some studies lah. Okay, that can reduce blood pressure is the garlic wildflower, the garlic
Okay.
pills, the garlic wildflower. Those have a little bit of effect on reducing blood pressure, but not much.
Not
Comparing to
much.
replace a medication, no. But
Okay.
to reduce a bit more, yeah.
That's fine. I mean, what we can do is we will have a quick chat maybe after this. Then we can get back to Miss Sid about the arginine.
Yeah, can, sure.
Get back to her. Yeah,
Yeah,
usually that's what we do as well. Yeah, we will usually
Yeah,
study and get
I
back to
think
you,
that
Miss.
will be better just to
Yeah,
keep the right
we'll get
info.
back to you. Yeah, okay.
Yeah, just to get
And
the right info.
we have Isaac. My relative is on co-approval.
Oh,
Yeah, it felt heart beats faster, around 100 beats per minute after 10 days. Is this a common side effect?
no.
No.
Mostly no. Co-approval is already a combination of medication. No? Like this, I think this one we have to know
Mm.
his blood pressure,
Okay.
because
Mm-hmm.
by taking call approval with 100 beats per minute
Mm-hmm.
is quite fast lah. It's quite fast.
Okay.
Thermal call approval is a very good pressure
Mm.
controller.
Yeah.
So I think we have to know this is definitely not the side effect, but I can say it is a we have to know the blood
We need
pressure
to do a
first.
further investigation
A
as
further
mutation.
investigation.
Yeah, it's
Yep,
not a
yep.
common side effects. Okay.
It's not a common side effect.
Okay. And we have
Mm,
Mr. Rocky. Mr. Rocky, I think the questions we have already answered just now, Mr. Rocky. So if
mm,
cholesterol is under control, is it possible to reduce? Our answer is it depends on the doctor judgment. So in
mm,
hospital, they may not reduce unless it's very low.
yeah.
But certain private practitioner, they may
Mm,
ask you to go on for 3 months. And if your symptoms improve, they may ask you, they may reduce the dose or even stop the medication. So that's depends on the individual and the doctors as well.
yeah.
Okay.
I think back to that call approval question,
Hmm.
just something to add on.
Yeah.
Call approval is actually added with the what we call is diuretics to reduce the water retention.
Hmm.
Uh, Maybe something that we can ask the Mr. Isaac,
Exact. Yeah.
Mr. Isaac to
Mm-hmm.
check, to ask him to bring the relatives to go and do a checkup, whether there's a
Mm-hmm.
retention on the lungs and all that. Because call approval once it's given, there must be a reason of water retention before.
Mm-hmm.
Because it's a medication of two blood pressure controller. One is a diuretic, but that one is mostly given when there previously was having any water retention, either on the leg or on the lungs. If there is
Mm-hmm.
a water retention on the lungs with cough and all that, there is a tendency of getting a high heartbeat rate. Yeah. So
Okay.
I think it's good to go and do a checkup.
To do a checkup.
Yeah, because it's
Right.
taking call approval.
Mm.
Mm.
Right. We have Halimi. Is it true that soluble fibers such as psyllium husk can help to reduce cholesterol?
Uh, it will lah. I can say it will lah. Because most of the fiber it helps to absorb the fats, the lipids.
Mm-hmm.
Okay.
Mm-hmm.
But specific a little bit, I think have to use the what is that called, the beta glucan type of fiber. The
Beta
beta glucan
glucan.
type, yeah, that one is much more specific to control, to absorb out the cholesterol in along with our food.
Okay.
But fiber did help.
Mm-hmm.
A
It
better
does
choice
help.
is chia seed, the non-soluble fiber chia seed,
The
because
non-soluble part. Mm-hmm.
those got omega in it. Got omega in
Okay.
it, it can help
Mm-hmm.
to increase the good cholesterol.
Okay. So, Mr. Halimi, we hope we did answer your questions.
Yeah.
And yeah, I've got the one questions. Usually, patients who are on blood thinning, for example, a brand start with P. Okay, let's put it this way. Is there any difference between original and generic medication? Yeah,
Oh.
like to cut costs, or certain people they prefer to stay on original. So, what is your insight about that?
For me, I think
Mm,
for serious cases,
mm-hmm,
I mean like those heart issue, blood thinning, and all that,
mm-hmm,
uh, it's better to go for the original brand first.
mm-hmm,
Okay, because those are the one who spend a longer time to prove its function, its effectiveness, its safety profile and all that.
mm-hmm,
The generic one is just to prove that they are the same, or we are using the same ingredient. We call it as bioequivalence is the same, which once this medication goes into your body, it's about 90 to 95% similar absorption. Okay, but what the original does is they do all the studies. They prove that it is so safe, it is so effective to give a control, to give a disease control. Yeah, much more developed study. That is why it is more pricey. But for you to change it to a generic, you can try, you can request, we can give you the generic because it's way cheaper. But please do a checkup. Please do a checkup because we have to make sure that the generic work the same as the original for you. Okay, although it works for someone else, but it doesn't mean that it works for you. All medication is tailor-made. We have to adjust according to the patient.
So I guess the main thing is if you choose to cut costs, and then it's okay. It's
It's
definitely
okay,
a
but
registered
long-term
product.
disease
Yeah.
only. Yeah, long-term disease
It's
only.
definitely a safe product. We have a very good stringent regulatory system in Malaysia. So as long as you can see the hologram and making sure you get it from a authorized pharmacy.
Can
So
say like that.
our medications are safe. But main thing like what Mr. Lim suggested, if you want to change, so make sure you do maybe a blood test or a blood pressure check to make sure they give the same effect. If
Yeah,
it
can
works
say
for
like that.
you, so yeah, you're lucky. But if it doesn't work for you, so you just change it back to your original.
I did see a readings, a profile readings before, a study reading before.
Yeah.
They suggested to us is for to use a generic brand is for those controllable cases, for controllable disease, like blood pressure, one of it, like blood pressure,
Yeah.
if I'm not wrong, the sugar, the diabetes, the cholesterol. But for cancer kind of diseases, what else? DVT, warfarin, needed a lot of blood thinning kind of things. They will just go for the original brand.
Or maybe
There is
possibly recently diagnosed.
probably recently diagnosed. They will
Mm-hmm.
go for the original brand.
Okay, right. So we have Miss Devi here. Is
Yeah.
it true that too much of medication will cause cognitive problems such as
Oh,
loss or confusion?
depends, I should say, right? Depends on what kind of medication.
Yeah. I mean, like,
Depends on what kind of
depends on
medication.
what kind of medication. So one that I can remember is, you might find it quite surprisingly, Piriton,
Eh,
papillonomy.
is it? Oh,
Yeah,
this one I
yeah,
don't know. It
yeah,
will
yeah,
have,
yeah.
is it because of the drowsiness effect that will cause cognitive
Um,
issue?
it was proven that if you're taking that for long term, it may increase your risk to get Alzheimer.
Ah,
Yeah. However, that's just one of the examples. So again, we maybe Miss Devi, if I like to answer, maybe it depends on which kind of medication.
yeah.
As you may know, there are so many medications, and like what I said, there are certain very common medications. If it may cause this problem, then surely we will prompt the patient. So maybe this is something you need to look out for. As there are many types of medication, this may not suit you to take for long term. So I hope that answers your question, Miss Devi.
But if I'm not wrong, the
Mm,
one that affect cognitive issue are those sleeping pills, schizo medication, those kind will affect a
yeah.
little bit. But to the extent of what, I'm not so sure.
Yeah,
But it
because
will.
like there are thousands of medication, but usually,
Yeah.
if you, Miss Devi, if you have like, for example, someone on a list of medication, what we can do, or usually pharmacists can do, we can bring the medication list to a pharmacist, and then they will go through one by one with you. So actually, this is called a medication review.
Yeah, medication review.
Yeah. So maybe, ladies and gentlemen, pharmacists usually what they can do is they can review your medication. Some will provide for free, or some will provide for a minimal cost. So what you will do is we'll go through your medication, making sure you are taking it correctly and doing your regular checkup, answer all your concerns like what we are doing now.
Mm.
Okay. So, wow, I think time really flies. It's about 45 minutes because today we say we want to keep,
Shorten it down. Keep it down.
yeah, because like
Yeah.
it's Mother's
We have
Day.
worked with Mother's Day.
Yeah, we should.
My mom's birthday as well. Yeah.
Your mom's birthday as well.
Yeah,
Okay.
my mom's birthday as well.
All right. So I guess before we end the session, just a soft reminder, guys. Please like and share this Facebook Live and hashtag I love my mom because and
We'll choose from.
see most creative answer and then we'll contact you after that. Okay.
Good.
Yep. Do you want to tell them like what is the secret prizes?
I think do you want me to tell them?
Yeah, can do.
Okay, my secret prize I sponsor is actually healthy drinks. Most of the mothers like lah, so that's why I picked this.
Mm-hmm.
Okay, and from NSMH is the blood test.
Yeah, blood packages.
Yeah,
Yes.
so if you are lucky winner, you're gonna get two things. You're gonna get a blood test,
Mm-hmm.
so you can bring your mom for free.
Yeah.
Okay, to NSCMH, which is located at Seremban.
Yeah.
At the same time, we're gonna deliver this to you. It's healthy drinks to you.
Mm-hmm.
Most of the moms like this, pink color, and it's a replacement kind of meal lah. Replacement that replace their coffee, their tea that may cause gastric. This is something else they can try lah. We're gonna give it out free for them.
Okay, thank you, Victor. There's question. Shall we just answer these last questions? Yeah,
Okay.
people with diabetic will always end up with insulin. I guess what he meant is diabetic patients do they always end up with insulin?
No.
No.
No. Okay. One good example that I have is my dad. Okay. He did exercise weekly, like weekly 3 to 2 times a day, 3 to 2 times a week. Sugar control considered good. Most of the people that tends to end up with insulin are the ones that doesn't control their diet, their lifestyle, even though they are taking medication. And most of the time we ask them to reduce their rice intake and all that. It's kind of hard because sweet things tend to get addictive sometimes, so it's very hard to cut it down. So the one that costs to use insulin are your lifestyle, not the medication.
I see. So meaning maybe poor control.
Poor control, definitely poor control.
Yeah, and possibly depends of which type of diabetes. We have type 1, type 2, right? So
yes, type 1. If let's say type 1.
Yeah, if it is type 1, surely you will have to go on insulins, or there are some new types of insulin. So to answer them, Mr. Kamarudin, so firstly, we need to know which type diabetic you are. And secondly, Mr. Lim, Victor answer the questions. If it is
lifestyle are the one.
Yeah, and now you will need to get insulin and lots of injections.
Yeah.
Okay. Right, I think we had a very good session today. Thank you, Victor.
Yeah. Thank you for inviting me again.
No problem. So after this, we shall invite you again to talk about some other medications.
Yeah, ED is one of it, I think.
Yeah, maybe we should talk about ED, right?
Yeah.
Okay.
That's a very interesting topic to talk about. I think it's quite kind of interesting, people worry that medication, mostly men, worry that medication really causes ED. A lot of them ask me this, I kind of like don't know how to answer them as well.
That's fine. So I guess it's a good topic. So remember this. So the next one we are going to talk about how to combat these side effects.
Combat this side effect. Yeah.
Okay. All right then. So we shall end the session and then hi, good evening, Azura. Okay, so we're gonna say bye-bye to our audience.
Okay, bye. Happy Mother's Day to everyone. Thank you.
Happy Mother's Day. Bye-bye.
Yeah, bye-bye.